Beta blockers. One of beta blockers is propranolol, which the mode of action is blocking beta-1 and beta-2 receptor. When it blocks beta-1 receptor, it will cause reduced cardiac output in the heart. Moreover, if it inhibits the beta receptor in kidney, it will inhibit renin release to depress the RAAS system. It will also block the peripheral presynaptic beta adrenoreceptors, which then decrease the sympathetic outflow and cause vasodilation. Moreover, propranolol also reduces the force of contraction of the heart muscles and thereby lowers the blood pressure. Some of contraindication when patient consuming propranolol is it can cause worsening of asthma, peripheral vascular disease, bradycardia, heart block, and also congestive heart failure.
Atenolol is one of the beta-adrenergic blocking agents that blocks the effect of adrenergic chemicals. The mechanism of action is atenolol enters the bloodstream through gastrointestinal tract and prevent adrenaline from attaching to the receptors on heart cells. Hence, it helps to reduce heart rate, contractility, and lowers blood pressure. The indications are to treat high blood pressure, to treat a type of long-term chest pain which is stable angina in some people, and also to treat heart attack. Some of the side effects of atenolol are dizziness, depression, shortness of breath, nausea, and tiredness.
The second antihypertensive agent is labetalol. Labetalol has a mixed-acting adrenoceptor blocker effect. It selectively blocks alpha-1 receptor, which will reduce vascular smooth muscle resistance, and it also acts as a non-selective beta blocker, which will decrease cardiac inotropic and myocardial oxygen consumption, and it also prevents reflex tachycardia. The indications for labetalol are hypertensive emergency and pheochromocytoma.
Carvedilol. Its mechanism of action inhibits exercise-induced tachycardia through its inhibition of beta adrenoreceptors. Its action at alpha-1 adrenergic receptor. It relaxes smooth muscle in vasculature, leading to reduced peripheral vascular resistance. Therefore, overall reduction in
Prazosin is an example of an alpha blocker. Its method of action is that it is a selective alpha-1 adrenoceptor competitive antagonist, and it acts reversibly. It produces arterial and venous dilation, which would lead to a decrease in blood pressure. It also has lesser effects on the alpha-2 receptor, therefore, it causes lesser tachycardia. The side effects of prazosin are dizziness, drowsiness, and headache. Indications for prazosin include arterial hypertension and congestive chronic heart failure.
Doxazazine is a non-selective alpha-1 adrenergic antagonist, or we can call it as alpha blocker. Doxazazine selectively inhibits the postsynaptic alpha-1 receptors on vascular smooth muscle by non-selectively blocking the alpha-1A, alpha-1B, and alpha-1D subtypes. This action of blood vessels reduces the systemic peripheral vascular resistance and reducing the blood pressure as well. The side effect of doxazazine is low blood pressure, headache, and shortness of breath. The indication of doxazazine are benign prostatic hyperplasia and hypertension.
Methyl-DOPA is a centrally acting agent. Methyl-DOPA has dual mechanism of action. It is a competitive inhibitor of enzyme dopa decarboxylase. This inhibition results in reduced dopaminergic and adrenergic neurotransmission in the peripheral nervous system, and it may lower the blood pressure, cause central nervous system effects such as depression. It is also converted to alpha-methyl-norepinephrine by dopamine beta hydroxylase. It is an agonist of presynaptic central nervous system alpha-2 adrenergic receptors. Activation of these receptors in the brainstem appears to inhibit sympathetic nervous system output and lowers the blood pressure. The side effects of this agent is it causes depression and Parkinsonism. And this medication is used to treat hypertension and gestational hypertension and preeclampsia.
Conidine is one of the centrally acting agents, and it is partial agonist. It acts on the alpha-2 rather than alpha-1. So it stimulates alpha-2 receptor in brainstem and inhibit release of acetylcholine and adrenaline from the sympathetic presynaptic nervous system. So conidine cause decrease of the sympathetic outflow, reduce the heart rate, and also the peripheral vascular system. For the side effect, it causes dry mouth, sedation, and also nightmare.